Hey, this is Dr. David Shapiro of Complete Spine Solutions, and you have probably been wondering what goes on behind the scenes at a chiropractor's office. Like, what is your doctor actually saying about you or thinking about you? And we have got it all here. We're taking you behind the scenes. We're going to do a live video here of what goes on at one of our clinical reviews. So please join us. Sit along for the ride. It may not be fully exciting. I don't know. It's not all. This is literally what we do. So here we go. And I want to introduce Dr. Alyssa Dennis of Complete Spine Solutions. Also sitting in this meeting, which we also eat lunch. This is also what goes on. That's Simone, and she's in charge of her rehab. And there's Mike. Mike's interning with us from Life University and getting ready to graduate in just literally, how many weeks left you got? 8 weeks?
Less. Like halfway.
Wow, awesome. And Simone and all of us here at the office, not just the clinical team who's sitting in on this meeting, is really responsible for getting everybody's outcome. So with that, I'm turning over to Dr. Dennis, and we're going to be, you're just being a voyeur and just sitting in our meeting.
So. All right, guys. Welcome to Clinical Review. Okay, so we're going to go with the Harry Potter theme for our patients today. So case 1 is Luna. She's a 28-year-old female. Alright, primary health issues is she has low immune system function, headaches, low energy, sensitive skin, and difficulty sleeping. Important things to note is that she's really active, really in shape. She actually trains with a personal trainer. She's a teacher. She's also a wizard because she's Luna. Her father's a chiropractor. She went to the Carrick Institute for a neurological workup, and she was diagnosed there with a brain injury from stress. And she's just really suffering and frustrated and trying to find out what's going on and if we can help her. So we had her fill out the neck disability index and upper extremity, so arm functional index. It's a few questions basically to ask what type of disability she has. Ideally you want to be at 0%, that means you have zero disability. So with her neck, she has 36% disability there, and then arm 29%. So definitely a lot going on there, and she's definitely suffering. Positive exam findings, she had a loss of range of motion in her neck, in all motions. Decreased lower extremity reflexes, so legs we're talking about there. Neck muscle weakness, positive cervical distraction and maximum cervical compression tests. Loss of lumbar extension with pain. And her posture presented as she had anterior head translation, meaning that her head was forward, a high right shoulder, and then also her pelvis was forward.
You want to just demonstrate that posture for us so we can see what's going on?
Like that.
Okay.
Not awesome. A good look, right?
Okay.
Okay, so we took x-rays of her to see what was going on the inside, because based on her posture, there's definitely some kind of distortion going on in her spine. So I'm going to go through those real quick. So this is an x-ray of her low back from the front. This is her pelvis down here, bones of the low back, and then her rib cage starts up there. She has some sacral unleveling. This is the lowest portion of your spine and shifted off slightly to the right. This is her neck from the front. Head's up here, bones in the neck, top of the rib cage here. So she has an angle in her neck, off to the right. Now, she definitely had slight distortions looking from the front, but now looking from the side, that was the majority of the problem in looking at her posture, so we suspected that her spine would match up the same way as well. So this is her low back from the side. This is the pelvis down here. The bones of the low back.
Which is the front and the back, just so.
This is the front here, okay. The back here. The green line represents normal. Her spine is the red line here. So obviously she is pretty far forward from that green line, and she has some extension in her low back, meaning she has a lot of arching going on. This is her mid-back and upper back from the side. So again, this is the front, this is the back. The green line is the normal line here. She's the red line here. So again, she's pretty far backwards compared to that green line. She also has an increase in curve in her mid-back, so that puts a lot of compressive forces on the chest cavity and the structures that are in the chest cavity here. So, you know, as a young 28-year-old, that is pretty bad to see, because this kind of posture is progressive, meaning that it's going to get worse over time. And eventually, if we didn't do anything to help correct it, she would turn into someone who has the hunchback that you see in a lot of older people. So that is a big thing that we were looking at with her and trying to prevent. This is her neck from the side. So the teeth are right here, so this is the front of the face, back of the head, bones in the neck, and then the shoulders are here. So again, green line is normal, red line is her. Obviously you can see there's a big issue in terms of the curve of her neck. So at the bottom here, she's actually increased in curve. Then she actually reverses and goes the opposite direction at the top, which is a huge red flag. This is a very typical presentation for headache sufferers and chronic neck tension and low energy. All the nerves that come out from the neck supply a bunch of vital organs in our body, so that's a huge problem with her. So our focus in this presentation is to help to reverse this curve in here, get it back closer to that green line. And she also, she has that forward head position as well. So the exercises that we prescribe for her in office are all postural exercises. So these were all specific to her spine and her posture. So like we talked about, she lost that curve in her upper neck. So we gave her a prolordotic exercise, that's what this is called, to help extend that upper neck region, help to get that curve back in there, and help to take pressure off of the discs and the nerves in the neck. So that is why we gave her that. This one, we talked about how her mid-back and upper back curve was increased. So by putting a block behind her mid-back there and squeezing the shoulder blades back, that helps to flatten out the mid-back there, and also helps to increase muscle strength in the back muscles to help with that posture. And then this exercise was given to increase core strength. So that was that. And her traction in office, which is a gentle stretching of the spinal ligaments to help restore proper posture in spinal position. We did UTS, Universal Traction System. It's one of the equipment that we have in here. And our primary goals with her, again, were to flatten the thoracic spine. This is a fancy word for the mid-back. And then increase that upper neck curve, again, that we saw that was going the other way. And this is a tool that we use to do that.
Awesome.
Okay.
Is that it for her?
Mm-hmm.
Okay. So just so the viewers at home and just so our team's aware, this is a person who came to us, has sought chiropractic treatment before. In fact, her father's a chiropractor, as Dr. Dennis was mentioning. She went to the Carrick Institute, where they diagnosed her with a traumatic brain injury due to stress. It was a stress-created injury. Her quality of life has been terrible, severely suffering, debilitating pain on a daily basis, chronic headaches, and in terrible shape and really hurting every day. And can't do any of the things that she wants to do. She's literally an athlete. She loves to do sports, be really, really active, and isn't able to do that anymore. So what we're doing is we're going to be changing her mechanics, and with that, we hope to get her to achieve her goals. So this is what we do with patients. We talk about their cases initially when they first start care here to figure out what we're doing with them, what their symptoms are, what kind of conditions, what kind of struggles they're dealing with. And then we make a plan, which is what we're discussing at this meeting, of how we're going to resolve their mechanical issues, which in turn is going to have a huge impact on their neurologic function and quality of life going forward. So that's patient number one. Even though we called her Luna, right? We called her Luna. That's really a real patient. She's not truly a wizard, but she is going to become one when when we're done treating her. Okay, back
Do
to
you guys want to
Dr.
talk
Dennis.
about anything with this case? Do you have any questions? No? Okay. All right, case 2 is Hermione.
That's not her real name.
So this is a 43-year-old female. Her health concerns are neck pain. She has tinnitus every day. She actually has tried a ton of different treatments for that, taken a bunch of different medications, and none of those have worked.
What is that, by the way? Just for
Sorry. Tinnitus is a ringing in the ears. Migraines that get so bad that she has to stop working, and if she doesn't catch it before it comes on, she has to leave work. Really low energy, difficulty sleeping, gets crushing chest pain. She's had infertility problems in the past. She does have 2 young children now, but before she had her children, she tried for years to get pregnant and was having difficulty with that. A lot of anxiety, and also left SI joint pain, meaning it's a joint in the lower portion of the back, in the pelvis area. Important things to note is she's a radiation oncologist, so definitely a very hard worker. 2 young children, she's on a lot of medication, and she's really frustrated. These are the disability indexes that we talked about before. So the neck pain disability index, her score was 34%, low back disability 40%, and headache disability 32%. So again, these are also pretty high scores. Exam findings, loss of cervical range of motion, meaning her neck range of motion with pain, positive orthopedic tests in the neck and low back, and her posture, she had a high left shoulder, anterior head translation, meaning forward, a right head translation, so she was shifted off to the right with her head, and also she stood with anterior thoracic translation, meaning that her mid-back was forward like that. So we took x-rays to see what was going on the inside, because that is very important to know. This is her low back from the front. This is the pelvis down here, bones of the low back, rib cage up there. From this, I know it might be a little bit difficult for you guys to see, but ideally you want the femur head, so the top of the legs to be level, and also the base of the spine, the sacrum, to be level. She has significant unleveling in both of those, so her left leg is very short, and then she also has very significant sacral unleveling on that left side. So with that together, that causes her to lean off to the left. Now, with her, how she presented, she was having a lot of left SI joint pain, which is a joint right in here. Because of that unleveling, puts a lot of compressive force on the left side, and so that correlates exactly with what she presented with. So that is a major thing that we would want to focus on. This is her mid-back from the front. Not a lot going on there. But she does have in her upper back area angle over to the right, and then that continues up into the neck. This is her head up here. So she has that right head shifting, which we saw in her posture. There's a reason why people stand the way they do. Your body is built on your spine, and so when you have postural distortions, spine is probably going to show why you stand like that, and so we found out what was going on with that. She's shifted pretty significantly off to that right side.
I'm going to chime in for just a second here, and this is something that we strive for. Research shows that everybody should be within about a 4 millimeter differential, 4 millimeters or less. Your head and neck should be 4 millimeters or less over your sternum, over your spine. So basically, when someone's outside of that normal range, as this doctor was, she was shifted 11.5 millimeters. So that's way outside the normal range. Not really what we're looking for. One of our goals is to straighten that up along with other mechanical problems. And with that, again, we're expecting to see, as we virtually always do, huge neurologic and physiologic improvements. Okay, back to Dr. Dennis.
All right, now looking at her from the side, this is her low back from the side, pelvis down here, bones of the low back. Similar as our first case, she is shifted significantly forward in her low back, and she also has an increase of curve in her low back. So again, that low back extension. So that combined with the shifting off to the left puts, again, a lot of compressive forces on the discs, the nerves of the low back. So obviously this is definitely an issue. Mid back from the side, she has an increase of curve in the middle portion here, and then goes pretty straight in the upper portion. So that is something we would also want to address. And then this is her neck from the side. So teeth are here, back of the head, bones of the neck, top of the shoulders. Green line is normal, red line is her. So she is shifted forward, she has an anterior head translation, and the curve in the lower portion of her neck is basically completely straight. And so that is obviously a major issue, and that is something we want to focus on. And bringing that head back as well. Okay, so the exercises that we gave for her, on the first case, we wanted to angle the prolordotic upwards to get upper neck curve increase, but with Hermione, the lower neck is the part that we really want to focus on, so that's why it's more of a horizontal push there to increase that lower neck curve. We're having her doing some core stabilization exercises on the power plate, and then also she has that right head shift, so we're having her do exercises to bring it back over to the left and strengthen those muscles of the neck to maintain that good posture. This is a little bit of a makeshift showing of the traction, but
Looks pretty good.
since she was shifted off to the left, so looking at this body, it would be over this way. This isn't her, by the way. We put a block underneath her upper low back area to shift her up to the right. And then since her head is shifted to the right, we are going to pull on her neck and bring it back down to the left.
All right, so that's, by the way, a shout out to my good friend, Dr. Deed Harrison, who that is his table, and Adrian Dennerwall's table. That's called the Dennerwall table. So that's what we're using to traction out and correct her mechanical problems. Excellent. Is that it for her?
No, not yet.
Oh, go keep
Wait,
going.
is it? Actually, I think it is.
Okay. Okay.
So yeah, sorry, one more thing to
Go
know.
ahead.
It's really important to correct side-to-side problems before you work on front to back. So that's our primary focus for the first month of care, and then once after we're done with about 12 visits, we'll re-x-ray and see her progress, and if she's gotten as close as we want her to, so below 4 millimeters of that head shifting, then we will start working on the front to back plane. So just wanted to put that.
Okay, I want to comment on this patient since I spent quite a bit of time with her already. This is a mother of two, and she is basically unable to lift her youngest child. Her child wants to be picked up, and she's in just too much pain. She's suffering as a physician at work. Her job involves a lot of sitting, a lot of standing in front of the computer, and she is in agony basically all the time. It boils down to she's really not the mom that she really wants to be. She's not living life to its fullest. She is someone who likes to be active and do a lot of activities and actions and just outdoor activities, etc. And she's suffering at work. And basically, when we reviewed these results with her, she said that really, for the first time, this makes complete sense. This approach that we're taking in this office is the first time anybody has talked to her about something that makes a logical sense. And here's someone who's used to in medicine, oftentimes they're going to be prescribing medication for all of these different health issues that she came in with. And she's done that. She takes tons of medication to no avail. When the medication wears off, her symptoms return. So we're looking at making a permanent change in her and a permanent solution with this permanent correction. And with that, we hope all of her symptoms resolve and she can live the quality of life that she wants and be the mom that she wants to be and be the doctor that she really wants to be. So that's my 2 cents on that patient.
Is there anything you guys want to know?
Okay.
All right. Okay, so third and last case. This is Ron, and he has been doing corrective care for 24 visits now. We take interim x-rays to make sure that we're progressing the way we want to, and if we want to tweak anything halfway through, then we're able to do that. So I'm going to show you his pre and post before when he first came in to now that he is doing corrective care and working on his spine. So his health concerns when he first came in, he was in agony. He had excruciating pain between his shoulder blades. His right hand was numb, his right arm. He had pain down his arms and weakness, or down the right arm. Low energy, headaches. He was only getting 1 to 2 hours of sleep a night because he was in so much pain. Acid reflux, low back pain, and also chronic sinus infection. Important things to note, he is in marketing. He's a really big family man. He goes to a lot of sporting events for his kids, so that matters a lot to him, for him to be able to be there with his family, and him not being able to do that was really weighing on him, so he wanted to figure out what's going on. He had prior football trauma when he used to play in high school, and he had 2 prior low back surgeries, a discectomy and a lumbar fusion, and then, and like I was saying, he was really suffering and just couldn't function. Upper extremity functional index, so we're talking about his right arm issues. This is one of the things that we wanted to see what kind of disability he was going through. So again, significant percentages here, and after going through less than 2 months of corrective care, we went from 24% disability to 1% disability. So that is by correcting his structure, taking pressure off of the nerves that go down the arm. We were able to restore that function, and so now his arm doesn't bother him anymore. So that's pretty awesome. Exam findings. On the initial, he had decreased range of motion in his neck. Every motion that he did caused that scapular pain, the mid-back pain underneath the scapula, the shoulder blades. Neck weakness on right and left lateral flexion, so bending to the side, and then also decreased leg reflexes. On the 13th visit re-exam, he only had a slight neck pain just on turning to the right. And then on the 26th re-exam, which we did very recently, he had nothing. So it's pretty awesome. And Arnold Schwarzenegger gives you a thumbs up. Okay, so these are his x-rays when he first started compared to now. Now, realized he was not keeping up with the 3 visits a week, which we usually do, so the dates are a little bit more drawn out than they typically are, but regardless. This is pre versus post neck x-ray. So when he first came in, he had a very significant anterior head translation, so his head was shifted forward compared to the green line, which is here. I know it's kind of difficult to see on there, I'm sure. And we worked on bringing his head back, and now he is much closer to that green line. The gap came closer together significantly. Let's go to the numbers here. So we got him from being 34 millimeters forward to 20. So that is a huge improvement, just over 2 months. And that was what we were really working on with his neck. Mid-back, he had, like we talked about with the first patient, a very significant increase in mid-back curve. You can see how far off that red line is compared to the green normal line. So this was a huge problem. This was the primary problem that we were working on by doing his traction exercises and getting adjusted in office and then doing daily home care. Look how much closer he is to that green line.
It's awesome.
Huge. So initially he had a 59-degree curve in his mid-back. The normal is 44. And in 2 months we've got, so great improvement there. Also the translation was 52 millimeters before, and we brought it down to 7. So that is just incredible. And when you fix the structure, again, you take pressure off of the nerves and organs and everything. So that's why he doesn't have any problems anymore, because he's working on correcting the problem, which is awesome. So yeah. Oh, I want to show you the exercise we did with him. So like we did with case 1. We are trying to flatten out that mid-back, so that is what this exercise is for. Squeeze the shoulder blades together. Also doing head retraction exercises. I don't know if you can really tell from this picture, but he's basically bringing his head backwards. So we're doing an exercise with that.
We're doing that against resistance also, right?
Yeah.
Okay, got it.
I didn't have a picture of
I know,
that.
it's all good, it's all good.
And then on the power plate, he is working on bringing his mid-back backwards, and then again flattening out that mid-back curve. And this is my traction setup that I couldn't really get a good picture of. So.
No, if you're a potential patient here, or maybe even a patient, I don't want you to be intimidated by this picture. It says 100 pounds is hanging off of his chin. We actually don't put that kind of pressure on anybody.
Sorry.
However, we do put pressure. And that is, it's mechanical resistance or mechanical pressure is the way you make mechanical change of any bone, and that's how we've achieved the results that we've gotten with them.
So in this setup, we have a thoracic dental roll, again part of that dental roll table, and that is to flatten out that mid-back curve. And then we hang a weight off of his chin. Again, it's not 100 pounds; it's still a lot more tolerable than that. To bring his head back and flatten out the upper thoracic curve, upper mid-back curve. So that's what he's been doing, and he's also been doing home traction, very similar to this without the weight. So far so good, and it's working out great.
Awesome.
This is his 2-month health improvement percentages, so we want to make sure that we track not just pain, but also overall function. And so in that 2 months, he's gotten 90% improvement in the pain between his shoulder blades. Right hand numbness is 25% better. Right arm pain and weakness, gone. Low energy, he no longer has low energy, which is huge for him because, again, I said he's a very involved dad. So him being able to do that, to be there for his kids' sports and everything was huge for him. Headache, 60% better. Sleeping perfectly fine now. Acid reflux has not improved yet, but that should get better as we improve structure, especially in the mid-back, which puts a lot of pressure on the stomach and the organs in your abdomen. By flattening out that mid-back curve, then the neurology functions better, and the stomach function will get better over time. Low back pain no more, and sinus issues no more. So I'm super excited for him that he's seen such great improvements.
Awesome.
That's it.
Is that it?
Yeah.
All right. Fantastic. So couple of takeaways. First of all, we really haven't held anything back. We've shared with you really behind the scenes what we do here on a weekly basis in our clinical reviews. We go over patient results from start to finish, even the results that are phenomenal, as well as the results that are not what we expected. We go over those as well. And it's not any one person's job in the office to get these results. In fact, we all work as a team, everybody from the front office staff to our rehab manager, to our interns, to our doctors. Our whole role is to improve your quality of life. We do that by improving the mechanics. That is our secret sauce, so to speak, of how we make that change in people to change their life going forward. So please share this information, share this video with your friends, family, anybody who isn't living life to their potential. We probably can help you, but it all starts with an initial exam. So call us up, get a consultation if you're not a current patient here. Just find out. Let's see if you have a mechanical problem. If you do, we can talk about it. If you don't, there's really not much to talk about. There's probably not a big way we can help you. I'm looking forward to helping you change your life, continue, fight the fight, and I hope you've learned something from seeing what we do in this office and how we care about our patients and how we review their results and want you to live a happy and healthy quality of life. Have an awesome day. Say goodbye, everybody.
Bye.
Thanks all.